Welcome, everybody. My name is Abhi Devanayagam. I'm a doctor, I'm a researcher and an activist, and I'm a member of the Race and Health Collective, and I'm part of the Envisioning Environmental Equity project, which is a collaboration between Race and Health, Youth Advocates for Climate Action Philippines, or YACAP, University of Sao Paulo, and Climate Operation Uganda. So I refer to Envisioning Environmental Equity as EEE because it's quite a mouthful. So the EEE project aims to highlight the critical role of colonialism, racism, and discrimination in distributing what we see as the health impacts of climate change. And the project increases engagement and platforms for most affected people and areas, especially youth, on these issues. And this project's program of work has included a podcast series, documentary films on environmental justice and health, workshops with young people in the Philippines, Brazil, and Uganda on climate change, racism, colonialism, and health, the creation of an educator's guide on climate and health justice, which will be launching very soon, as well as an academic review paper on climate and health justice. You can find out more about this project on the Race and Health website, as well as the Twitter and Instagram pages at Race and Health. Before we dive in, a note on housekeeping. Obviously, we will be speaking in English today. If there's any jargon that you don't understand, please do ask. If you have any questions throughout the session, you can use the question function, which is on Zoom, or you can also tweet at Race and Health. Please do keep yourself muted when you're not speaking. So this is the first webinar in a series of 4 altogether. And the series is titled Responding to Health and Climate Injustices, Possibilities for Health Professionals. And this particular webinar today will provide the backbone analysis of the problems. And then the next one in October will focus on the steps that we can take, especially if you identify as part of the health community. And further information is available on the Race and Health website, and you can register your interest for all the webinars in advance. Climate-related health disparities are not an issue of the future. They are very much a reality for the most minoritized people, no matter where they are in the world. Our fellow humans living in the Niger Delta, for them, extractivist practices by big oil companies that drive climate change have led to a 10-year life expectancy gap. For Inuit and Alaska natives, sea ice changes due to global warming is already constraining their access to food. In Pakistan, our siblings have been devastated by floods. And in Puerto Rico this week, Hurricane Fiona has killed 2 people and left thousands without drinking water. And we mourn the irreparable loss that is caused by the racist and colonial legacies that are killing our fellow human beings. And in this webinar, our panel of speakers will discuss these disparities and some of the root causes of these inequalities: colonialism, racism, and discrimination. So I would love to introduce our speakers today. We have Araceli Carmago. Araceli is a neuroscientist and works for the Centric Lab, a research lab that focuses on environmental and health justice. Her line of work is concentrated on studying how the places that we inhabit affect health. She holds an MSc from King's College London, and she's a descendant of the Turtle Island peoples. Welcome, Araceli. Kavian Kulasabanathan. Kavian is an emergency medicine physician with a focus on structural violence as a determinant of poor health, community-led models of care, and uses of the collective imagination envisioning for abolitionist futures. He's also a member of Race and Health and the People's Health Movement. Welcome, Kavian. And finally, Renzo Guinto. Renzo is the Chief Planetary Health Scientist and co-founder of the Sunway Center for Planetary Health in Kuala Lumpur, Malaysia. He's also the Associate Professor of the Practice of Global Public Health and inaugural Director of the Planetary and Global Health Program in the St. Luke's Medical Center College of Medicine in the Philippines. He's a member of the National Panel of Technical Experts of the Climate Change Commission of the Philippines and convener of the Planetary Health Philippines, a community of Filipino scholars and practitioners for advancing the new discipline of planetary health. Welcome, Renzo. Thank you so much, all three of you, for being here. I've been so excited to speak to you, all three of you this week. So we will start with an opening question. Why do you work on climate-related health inequalities and injustices? I'll go to Araceli first, if that's okay.
Okay, you can tap me on the virtual shoulder if I am going too far or taking too much time. Well, the most direct answer is, well, why not? Because that's what is actually affecting our health. The longer answer is, I created this little tree. Maybe I'll start from the bottom up. We have created, and by we, I mean the West. And by West, I don't mean a specific geographical locality. I mean those who subscribe to the idea of capitalism, progress, and ignore our solidarity and symbiosis with nature. That's who I mean when I say the West. This Western philosophy and Western lexicon, for the most part, looks at health as an individualized phenomena, not an epistemology. Epistemology is one of the sciences that does look at health from an ecological perspective, but it has stayed in a more academic realm than bringing it out. As the general public, we are told that our health is a potluck of maybe bad luck, good luck, and what we have as genes, rather than looking at things such as the places that we live, the interactions of where we live, right? So in a direct way, if we are drinking dirty, contaminated water because there's been an oil spill, because there has been a devastation within the habitat that is polluting the water, that is going to make us sick. That's not a mystery. That's not anything to do directly with our genes. In a systemic manner, if we look at that, also that phenomenon of the contamination of water, it is a trauma. To not have one of your essential building blocks of life is a traumatic experience. Trauma, as we know, changes us at a very cellular level. So we are understanding, our main focus at our lab is that we focus on the hypothalamic pituitary adrenal axis, so the colloquially known as the stress response. So the stress response is a very adaptive response. It's a needed response, but we're pushing it too hard. And some of us, we get pushed and pushed and pushed where there is the inequity, which we're calling biological inequity. So again, you have these conversations, these macro narratives that people say, indigenous people, or in the case of Turtle Island people, we're more susceptible to diabetes. What does that mean, right? Is it, and they tell us that it's our gene, right? They look at parents, I'm told, you better be careful because there is diabetes in your family, you're going to get it. But the thing is that I'm not going to get it. It's not in my genes. It has to do with the environment that I'm in. So I'm not living in an area of high levels of air pollution like my ancestors did. I am not living in acute and constant trauma the way that my ancestors did, that deregulated their system, that changed the way that their metabolic system responded to the environment, which is the root cause of diabetes. So the justice side for us is three things then, and we take all of that into consideration, is number one, bringing in more accuracy to the science realm, that we're not getting sick and or that disease of pathology has anything to do or is only to do with disease. B, for our healing methods to get more empathic and expansive, right? We, again, in the West, we deal with health by doing meditation, going for a run. But meditation, whilst it's fantastic with breathing in toxic air, that's not going to help us. So we have to think systemically and ecologically. And 3, it's so we can affect policy, because policy right now, again, in the West, is only there to serve capital and protect capitalistic progress. It's not there to safeguard or support health or healing.
Thank you so much, Araceli. I'll move on to Kavian. Same question to you. Why do you work on climate-related health inequalities and injustices?
Thanks, Abby. Thanks so much, Araceli. Yeah, I really want to pick up on some of those threads maybe slightly later on. We can circle back to them, really resonate with a lot of what you said. I suppose want to maybe like take a couple steps back and just say very appreciative and grateful to be in the space and be invited, and also to shout out solidarity and power to the dockers in Liverpool that are striking, and to all the other legends out there that are moving to resist the extractive labour practices that have landed us in this position in the first place. The CWU, the RMT, ASLEF, who have strikes lined up in the next couple of weeks. This is all deeply related, and when I speak later on, I'm going to pull those threads together. I guess for me, I'm an Ulam Tamil from Sri Lanka, and I guess my political consciousness and certainly understanding of injustice is grounded in the colonial history, the colonial history and the colonial present of the island, which then went on to set the stage for an ethno-nationalist genocide, an ongoing ecocide. And I guess, as a thrice colonized, war-ravaged, and hugely climate vulnerable island, it was, a very natural place for me to come and land into in terms of a space to work around. Although maybe just worth, I guess, in terms of my own journey, like I really resisted entering the climate space for a long time. I obviously appreciated for the aforementioned reasons why it was so relevant, but I struggled with how white, in a literal and also structural sense, and really deeply lacking in any kind of structural analysis. I felt like the climate spaces that I'd been exposed to were. And then I met Abby and several others who, were working at much deeper levels in terms of thinking about intersections of climate justice, spatial justice, racial justice, health justice. And so, haven't really looked back since then. So that's kind of my journey.
Thank you, Kavian, for sharing that with us. Renzo.
Yes, thank you very much for this opportunity. And, I'm really thrilled that we can have this conversation thanks to these virtual platforms, because a lot of these conversations, unfortunately, tend to marginalize people who are not in the room, who are perhaps, disconnected through distance. So, for example, there have been a lot of conversations around climate change and global health that has been happening in the imperial capitals of Europe and North America. And many of us in Asia, I'm joining you from Manila, tend to be really, disconnected, detached, marginalized, not included. And so I'm very grateful that we have this platform, and I hope that there'll be more of these kinds of conversations that are truly international and inclusive, and democratic even. Why am I doing this kind of work? Why I am very passionate about climate and health, especially through the lens of equity and justice. I am trained as a physician. And I remember when I was, growing up as a young doctor, I was already seeing firsthand the impacts of climate change in my country, the Philippines, one of the countries in the world that is at the heart of the climate crisis. In fact, these past 2 weeks have been really stormy and rainy in our cities in the country, in our more than 7,000 islands. And we have been witnessing over the past several decades, and especially in the recent years, how climate change truly impacts the health of human populations and not just in aggregate terms, but the effects of climate change are happening and manifesting in uneven ways. There are populations or subpopulations that are certainly much more affected than the others. Patients that I've seen in the emergency room or in the clinics when I was, a budding physician in the country's national public hospital. And these are patients who do not have access to, the necessary resources in order to adapt to this existential threat, which, by the way, they have nothing to do with, because they have not been benefiting from, what Araceli was saying, this capitalist system that has emitted carbon into the atmosphere, destabilized the climate system, and eventually, and as a result, leading to these myriad health impacts and exacerbating the existing inequalities that we already have in the world. And so that really is, I guess, the starting point of my journey. And since then, now I'm not anymore treating individual patients because, I've become frustrated. I can't be sitting inside the clinic waiting for the patient to give the symptomatic treatment and then move to the next patient and then to the other patient and turn a blind eye to the underlying causes of the many illnesses, despair, if not death, that we are seeing within the healthcare sector. And so that is what really brought me to this work around climate and health justice. And also, give me this experience has given me a lot of opportunities to meet, amazing advocates like Araceli and Kavian and Abby, to find ways to really not just solve these problems, but to usher a true and lasting healing of the world. So maybe I'll stop there. Thanks.
Thank you so much, Renzo. Thank you. Thank you for touching on your journeys. I know there's not much time to go into your journeys. I'd love to explore your journeys more. But if we can go now into some of the mechanisms, the pathways through how this happens, so that we can then spend the second part of the webinar alluding to solutions. So really outlining the mechanisms of the problem. So drawing especially on examples from your work. So we have clinical work, activism, policy work, academia amongst the three of you. So using some examples from your work, what is the role of colonialism, racism, discrimination, and these power hierarchies in creating and sustaining these injustices? I'll come to you first, Kavian.
Yeah, absolutely. No, thanks. And it was a really interesting provocation. And I guess, yeah, I mean, like you said, my background and work centers around understanding structural violence as a determinant of poor health. And so when you guys first invited me to come on, I wanted to try and cover as expansive an understanding of the role of kind of layers of colonialism and ongoing neocolonialism in creating climate-related health disparities. So apologies in advance, Abby. I've taken slightly a wide and loose interpretation of the brief in terms of including health disparities, kind of both as they relate to the extractivist projects that underlie and drive climate dysregulation, as well as the direct health impacts of climate change. So I really want to, I'm reading abolition geography at the moment, and really want to lean heavily, as I always do, on Ruth Orson Gilmore and her understanding of spatial and temporal justice, and maybe want to start with her definition of racism, which I find very helpful, which is to say a state-sanctioned and or extra-legal production and exploitation of group-differentiated vulnerability to premature death. And that's the kind of the temporal justice element as I interpret it. And so what we see is that in multiple planes, colonialism and racism emerge as this engine behind mutually reinforcing ways that not only maintain but reproduce the violence towards minoritized people and lead to premature death. And so I really want to briefly peel back and tease apart the sedimentary strata of colonialism in producing these inequities, and wanted to go through three examples. If we get to the third one, don't get to the third one, that's also totally fine. But wanted to start with the role of the military, actually. military and paramilitary forces, they have this central role in underwriting the settler colonial project, which has harmed the health of so many people from the initial process of dispossession. So that's, whether it's the British or the Dutch East India Company, flanked directly by their own private presidency armies, or the crackdown on protesters resisting the Dakota Access Pipeline in Standing Rock, all the way through to direct polluting impacts of military occupations, as we see in Hawaii, or the settler colonial context of Hawaii, where poisoning of the aquifers by fuel leaks at Red Hill being the most recent iteration of colonial kind of military environmental brutality. I think the example of the Ogoni people, who Abby and I are working with, a brother, Ken Henshaw from We the People, who really helped me more deeply understand how these layers of colonial violence kind of stack up, I guess, is that, we saw the invasion of Ogoni land in the Niger Delta by Shell to drill for oil over several decades, explicitly underwritten by brutal violence of a Nigerian army. This was exemplified by the execution of Ken Saro-Wiwa and the Ogoni Nine. This Nigerian army was trained under the guise of counterterrorism by the UK Army. It was armed by ongoing munition supplies from the UK and US to bolster global North shareholder value, whilst at the same time, the Ogoni people's water table is polluted with hydrocarbons, with lead. Nothing can grow there. They themselves face fuel poverty, so they don't even get the benefits of the local fossil fuel resource, and increased threats from flooding, drought, and climate dysregulation in the context of a global military complex that's responsible for 15 times the proportion of carbon emissions as the whole of Nigeria. So I kind of really want to highlight, I guess, like colonial militarism as an ongoing project that underwrites the extractive philosophies that are driving us to be in the place that we are. The second thing I wanted to talk about is food and nutrition, and this is something that you touched on, Araceli, and I really want to pick up where you left off. So I think it's quite a natural segue. Actually, I'm going to drop a link into the chat if that's okay, which is just that there. So yeah, I mean, a natural segue if you consider the role of the British military in driving the Bengal famine. But the first layer here, when I want to talk about food and nutrition, is food insecurity. And this obviously ties incredibly closely to climate dysregulation, as driven by emissions primarily from the imperial core. But I also want to draw links to the legacy from export-centric colonial agricultural systems, where land was seen purely, as you pointed out, Araceli, as for surplus value extraction with a shift to cash crops, monocropping that decimated soils, for production of harvests that weren't even for the local people. They were to be consumed in the global north. And then the cultural erasure and impact of colonialism in tearing up forms of local solidarity, economy, and management of resources at times of shortage. This is then overlain and sustained by contemporary neocolonial enclosure of seed under intellectual property, F2 crops that demand repeated purchasing and may not be best suited to the land, and global domination by agribusiness, potentiated by trade liberalization, as well as the decimation of the ability to develop local kind of agri-ecological, kind of more older indigenous rooted practices, and infrastructure this through the decimation kind of wrought out by structural adjustment programs and underwritten then by the likes of Bill Gates and the so-called Green Revolution in Africa. So you have this situation where there's a direct impact of malnutrition, widespread starvation, that has an impact in immunocompromised people directly. But then the next layer of this is this intergenerational impact of malnutrition. We have research that shows that several generations following, we may be more susceptible to infectious diseases, but more crucially, it contributes to the predisposition to poor glycemic control, to intergenerational diabetes, which we see, plainly in my own clinic room in indigenous and racialized people. And that has obviously been further, exacerbated by trade liberalization and neocolonial trade agreements driving big sugar, processed foods. And so then the other layer of this is the gaslighting in our clinic rooms, where we have these members of this community that come in here in the UK, and don't forget they're here because we were there, right? Shout out Amblavan Sivanandan. And we willfully ignore these histories to individualize responsibility. And through the narrow biomedical paradigm that we have that's grounded in carceral logic, this manifests as racialized, particularly anti-Black fat phobia, which leads to the provision of systematic poorer healthcare. So I can't emphasize how much this is all kind of deeply tied up. And with growing food insecurity worldwide through climate dysregulation and land exploitation, this web is only going to be reproduced. And very, very quickly, if I have 30 seconds, I wanted to touch on pandemics. A lot of this, hopefully, you will have had a chance to think about already. But we're in a situation where with the climate crisis, it will set us up for more zoonotic spillover and more pandemics. And in this way, I interpret pandemics, including COVID-19, as a direct result, at least in part, of the ongoing climate crisis. And you all know who has been most impacted by the ongoing pandemic. That's racialized and disabled kin. Racial capitalism, which is what really lies at the heart of all of this, but of the extractive architectures that have always and continue to drive this crisis, they serve to situate racialized working class people nearest the sharp end of harm from the pandemic through the types of wage labor they occupy, through the schools they go to, through the quality of poor housing that they live in. The list goes on. Robin Maynard, in a really brilliant book, Rehearsals for Living, which I would highly recommend, which I'm reading at the moment, talks about whose public are we talking about in the context of so-called public health? Whose public is the public in public health serving? And we can take this a step further by saying somehow we have this rhetoric, or in contrast to that statement, where those excluded from that public are somehow included in the definition of Anthropocene and the understanding of responsibility for where we are. And in the context of the UK, this is the last line I wanted to say, I guess the same Tory governmental understanding of public health has removed mask mandates, has overseen global vaccine imperialism, and more long-term through its collusion, or not even collusion, its driving role in global philanthrocapitalism has dismantled the health systems that would then be able to deal with the pandemics, which these people aren't even responsible for. And we are responsible for through us driving climate dysregulation. So that, yeah, in summary, there's layers on layers on layers on layers of violence that unravels the whole system if we start to pull at the threads, and can be overwhelming, but hopefully in the second half of this, we can start to reflect on what liberation might look like and how, what we might start to be doing to get there. So yeah, thank you.
Oh, thank you so much, Kavian, for just weaving together so many different webs, military, food, and pandemics together in such an eloquent manner. And it just, makes me feel like there's just so much repair that needs to happen for this amount of violence, which I'm really looking forward to discussing shortly once we've had Araceli and Renzo's interventions as well. So Araceli, in your work, perhaps I can probe you a little bit further on why racism, colonialism, and discrimination are important in the way that we sculpt and understand these inequalities for taking action.
Okay, so I'm gonna go in three parts. I'm gonna start with some language parts, and then some vocabulary, and then moving down to practicality. We use these words, racism, colonialism, capitalism, without sometimes understanding its rootedness. So racism and colonialism, they are tools and needs for capital generation. That is what they are there for. It is not necessarily just because people don't like us because we're brown. It is very systemic. It goes above and beyond an interpersonal, which sometimes, socially on Twitter, etc., it gets explained at very rudimentary levels. So again, capitalism needs these two things in order to flourish. That got established as far back as the 4th and 5th century with feudalism. People wanted land. Again, we're going into Western Europe. They wanted land because land meant power. Eventually, you got to start explaining why you are owning land and others are not owning land. And you've got to also convince people on the long term. So you start to establish narratives and myths around why you, who looks a certain way, which in the case of Western Europe was white and male, you are going to be owning land. And it's still now in the UK aristocracy, your land and your castles or whatever the fuck get passed down only through the male heir, right? So even things like gender in the West, the female is the bearer of labor and or heir, and the male is the creator of labor and or the heir of capital. You don't fit into either of those two, which, like I said, you got to be white and you got to be male. And that's who wants to sustain the power. If you do not fit into that, you then become collateral damage for the generation of power that comes through capital. The second thing to understand is that even the land, capital T, capital L, also becomes marginalized, and all our siblings that are belonging to nature get marginalized, right? In terms that we now call sacrifice zones. And people like, we've discussed this before, like John Locke and Francis Bacon and all these thinkers of the Enlightenment period, and I'm putting it in quotations because there's nothing enlightened about justification of genocide. These people believed that the only way to assimilate or imagine progress was through the acute production of land, right? The generation then of wealth. You don't build castles on 2 peas and turnips, which is all they had in the UK at the time. You need massive amounts of capital, right? And so that's where our peoples come in. I can only speak for Turtle Island. They took our land, they took all our resources, our gold, et cetera, because they needed it to build. So let's understand that. That continues today. The military, again, is another tool because it used to be religion. I'm anointed by God, and we're going to see that with Charles, whatever the fuck his name is. He's going to be anointed. It's going to be done through God, and conveniently God looks like him, but not everybody subscribes to that. So now we got to get the military. They got to do it by force. So which is also why abolition of the police is also linked to health. Now, bringing it down to the building blocks, right? Again, looking at climate change in its building blocks, we look at planetary deregulation, because that is essentially what is happening. That's what causes climate change. Climate change is an output. So we can't fix an output, we got to fix inputs. So the inputs are, we need the land. So we're going to create genocide, a sort of, or any other type of violence through famines, through violence, like military violence, etc. So we can grab the land. Now we're going to grab the land from you and we're going to contaminate it, because we need to go in there and violate it as well. We're going to extract it. We're going to dismantle and deregulate habitats. So that deregulation of habitats from the microbiome, right, up becomes deregulated. So the things that the biome is so important for our health. What we are supposed to be breathing in and ingesting for our health, we no longer have access to. It's becoming deregulated. And that's what I mean about the building blocks. Yes, I understand that nutrition has everything, can heal 100%. I believe that. That's part of my heritage. But my peoples are not sick because they don't have access to nourishing food. They actually kept their indigeneity in terms of the food culture. They are sick because they don't have access to that nourishing microbiome, because one of the things that happened to indigenous people after you got your land taken out is that we are pushed into urban environments and ghettoized there, and breathing shitty air, having no access to clean water, living a very, very difficult, harsh life in these very harsh and violent environments. That's what also then deregulates our system. So we have a deregulation of planetary systems coming in, like I said, through the microbiome, deregulating our internal biological systems. And so then we get this parallel of sick planet, sick people. And that's the framing that we're using. And like I said, race then plays a role, so we can explain why people like that look like us are, like I said, sacrificed or used as collateral for the sense of progress. And then finally, John Locke, which I like using as an example because he is such an esteemed supposed thinker and a philosopher, which, you know, if you're in the realms of philosophy, your job is to think about thinking. And even he was asked, what about slavery? What about colonialism? What about the genocide? And he thought it was okay because we, the people at Turtle Island, weren't making our land productive. But the dum-dum didn't see the actual productivity of land, which is to sustain us, to sustain life, to sustain the whole entire system. That is an amazing sense of productivity, but he didn't see it that way. So then he was like, well, if they're not making it productive according to his law of commons, if you're not making it productive and somebody else comes in and makes it productive through agriculture, et cetera, then they have right over that land. And if they so happen to kill you because you're in their way, then that's fine, it's justified. So I think it's understanding these histories, understanding these frameworks, and understanding that race is that it's a tool, right? And then of course, then understanding those building blocks of planetary deregulation, which is what we live in day to day, which is what is affecting our health.
Thank you so much, Araceli. I feel like we've gone, like you mentioned inputs and outputs there. I feel like you've done a really good job of doing the inputs, and then Carvin has done some of the processes. And I feel like we should have maybe I should have gone the other way round, but we come to Renzo. So Renzo, I wonder if you could do us the honor of describing some of these outputs for our audience in a bit more depth. And yeah, what do these disparities, these sacrifices, the language that Araceli has used, look like across different communities, with some examples from your work, if you wish.
Sure. Well, thanks, Abby. And it's amazing just listening to Kavian and to Araceli, because in a way they are helping me provide some explanation and perhaps some theorization as to what we're seeing on the ground. For example, in a place like the Philippines, which as I've mentioned, a very vulnerable country to climate change. We are experiencing the impacts already, and the impacts are disproportionately borne by the poor, the marginalized, those living in low-lying islands across the country, the indigenous populations that are not included in conversations that are oftentimes happening in the capital or in the urban centers. Araceli mentioned already how we are kind of brainwashed and even pushed to move to the cities, and people who are left behind in the rural areas are the ones not just experiencing climate change firsthand and its myriad health effects, but also do not have the capacity to overcome these challenges. They are resource constrained. They do not have, the infrastructure and the ability to address these problems, these challenges. And then, we in the city, and who are working at the national level, who are working at the international level, with our colonial mindset and tendency, think, oh, we are the ones needed by these communities so that they can address their challenges. And that's happening in the form of aid. And that is happening in the form of this technical assistance being provided by multilaterals and bilaterals that are also, a very, very much a part of the power structures that created this mess in the first place. So it's really very complicated and multidirectional, but I think at the end of the day, it's really the people in the margins that are, you use the word, the sacrificing, right? That are the victims, that are really suffering from the consequences that they did not even create and want for themselves in the first place. But, the other thing is, when I work in the communities, when I go to these coastal communities, despite not being part of, perpetuating or creating the crime, the people in the front lines are the ones who are willing, to act. They're asking, what can we do? What can we make out of the limited resources in order to adapt to climate change and also perhaps help reduce our environmental footprint? And that is just so amazing and humbling. When you hear the victims themselves saying, we still have to, be part of the solution, I think that should be a slap in the face of people and countries and corporations who are the culprits of this existential crisis in the first place. I think I just want to also add another, Kavian already mentioned, there's so many layers, so many dimensions. And in a way, he already alluded to this. When we talk about the nexus of colonialism and climate and health and race, we oftentimes think of, the imperial powers and the colonial legacies that they left behind. For example, the Philippines is a country that had experienced not just one, not just two, but multiple phases of colonialism, from Spain to the United States for 50 years, to Japan, even under Britain for a few years' time, and even now, there are new forces of neocolonialism that we are experiencing. I've alluded to these consultants and corporations and funders, who think that they're doing charity, but in fact, they're merely doing band-aid for the problems that they are an accomplice to in creating and perpetuating in the first place. And there are new powers that also are arising, emerging economies surrounding our region, that are also now becoming part of the not only the carbon emissions, but really even solidifying the economic and political structures that are creating planetary health damage in the first place. So I hope these reflections somehow provided a glimpse of what you describe, Abby, as the outputs of that very complicated process that Kavian described, and the multiple inputs that Araceli just showed to us that create that dysregulation that she also referred to. I'll stop there.
Thank you, Renzo. Thank you so much. Really, really rich reflections. And of course, the inputs, processes, outputs, it's a linear way of thinking. It's obviously much, much more a web, a dynamic mess of a situation. But thank you so much for your reflections. We'll move on for the next 7 minutes or so on envisioning a future and imagining some solutions. So I want the three panelists to close your eyes if you want to, but you don't need to. But when you envision a world without these injustices, what do you see? And if you can keep it to 2 minutes each, that would be brilliant, so that we can have some Q&A from participants afterwards. I'll come to Kavian again first, if that's okay.
Gosh. Yeah, I mean, I suppose that
one more thing, sorry, what do you see, but also how does it make you feel?
So yeah, I mean, I guess whenever I think of kind of liberation, my instinct is like, I'm from a little island off the northwest coast of Sri Lanka called Nedumdiva, and it's kind of being there. It's still being there, for one, and there being kind of this community healing space with a little cooperative fishery, some regenerative farming, a little community health center with space for kind of somatic therapy and plural forms of healing. That's kind of the picture, the vision that I see. But I think in terms of broader stretches, it'd be a world that, understanding that, as Araceli also picked up on, the role of, I suppose, carcerality as an agent of extraction of racial capitalism, a dissolution of this, and that's in our hearts and minds, as Paula Rojas says, as much as it is materially, and that looks like no more police, no more prisons, no more militaries, no more borders, and that all ties very deeply to a philosophy of I guess of collaboration and of community care that has to underwrite a new way of being in relation with each other and land, and reversing the dysregulation that we spoke about. So yeah, I don't know if that's particularly focused, but yeah, that's kind of initially that was my feeling response. And then the second half maybe is yeah, wanting to think a bit more about tools of structural violence.
Thank you for sharing that, Kavian. We'll go to Renzo next and then come to Araceli.
Yeah, wow. I'm thinking of the tables where these discussions are being made, from the COPs, the many COPs that we've been organizing. Imagine we've been negotiating about the future of our children for 26 years. That's why it's COP 26. Now we're moving to COP 27. I would love a future COP where it's, people in the front lines, it's young people, it's indigenous communities, it's health professionals, it's climate advocates and activists who are leading the discussions, not politicians supported by fossil fuel money and who are just worried about the next election and not the future of their respective nations and citizens. Of course, people who might be listening might think, oh, that's utopia, right? But you ask me if I can imagine a world where which has the critical ingredients that will address the many, myriad web of challenges that we just discussed over the past several minutes. I think another vision is, yes, we can talk about these international platforms. Of course, at the national level, there's so much work that needs to be done. I'm fortunate that I have access to national government. You mentioned a while ago, Abby, I'm advising the country's climate change ministry. And so that in that way, we are trying to, incorporate ways on how to be, how to be a good listener to people, how to be inclusive of voices and faces who are, unheard of and invisible. But also I think as, practitioners and academics, we also need to walk the talk. I think that's also a personal vision that I have, apart from the global vision that we are currently trying to articulate, that we use the science that we have in order to really speak truth to power. We are guilty oftentimes of, being satisfied with the publication that we just tweeted about, but not necessarily making sure those knowledge that we generated really are brought to the policy tables, influence communities, and provide an armamentarium for the voiceless in order to, again, speak truth to power. So I hope that's also part of our vision. What I feel about what I've been saying for the past few minutes, yeah, I feel both inspired, but also very challenged. These are not very.
Thank you, Renzo. Thank you. Thanks for touching on the evidence, and the knowledges and whose knowledges as well. And that was really helpful. Impossible to go into more when we have 1 hour, but thank you for touching on that. Araceli, what do you see and how do you feel?
I feel very optimistic, actually. 4 things. One is envisioning a life. Well, actually, back the truck up. Everything that I am visualizing is something that has already come through the past. So these are not even new imaginings. So 1, mutual symbiosis with all our creators, land, water, air, and mutual symbiosis with all living kin. Active, sustained listening to all wisdoms, from soil to fungi to peoples. We always forget that we are not the only people on this planet. We have kin that is non-human kin that deserve to be listened to, that are screaming out wisdoms that we need to listen, that we need to intake. I also see a world that moves away from supremacy to self-esteem. Supremacy functions on all of us having no self-esteem and no self-love. Because when you self-love and you have actual esteem, you're not insecure and you operate from a point of abundance, not a point of scarcity. And then I also see a world that can sustain and does sustain multiple imaginations. What has been created is a reality. It is not all of realities. We call ourselves people. We could have been called other things. We cannot feel that we are incarcerated by this imagination and this reality that was created by supremacy, what we are living right now. This is Western imagination. This is Western imagination that tells us this is possible, this is not possible. Like I said, there are multiple imaginations. And for that, again, I would suggest that we turn to non-human kin for those imaginations that we can, through listening, bring forward.
Thank you, Araceli. I'll open up for questions now from the audience, but just very quickly, if I can actually ask the speakers to do this by typing if you wish, is to signpost any examples of work that should be supported, where some of these solutions and principles are being enacted, if you wish to do so. And we've got a question from Tamam. Welcome, Tamam. Good to see you. I don't know if I can see you, but can you unmute yourself and ask your question? Feel free to post it in the Q&A box. Tamam, can you unmute?
Okay, so I'm someone unmuted me. Thank you very much. I just wanted to thank you very much for such a good conversation. I want to give two small reflections. I have worked in humanitarian health for the whole of my life, and some of the painful experiences is not just the seeing of exploitative practices of formalized Western medical institutions, that, you know, the individualization of health that Araceli talked about, but also the weaponization of people themselves against themselves. So I've worked in Somalia, where indigenous people have eliminated the trees because they sold, they burned them, sold charcoal to get cut. I worked in Mozambique, where the only way of cooking is burning wood. I've worked in places where people have been pushed by this, you know, the capitalist machine into no solution except environmental destruction. And the level of information that we are privy to isn't available. There's a care about life and death that is immediate and constant, that forecloses the consideration anymore. And this is extracting people out of their indigeneity into a situation of poverty. It's not indigenous living anymore. It's just pure poverty in a Western context. So this is, I've never been able to deal with this, and I don't know what to do about it. How do you ask people who have been usurped by the capitalist machine to give a consent or a direction when we have actively deprived them of the tools to do so? The second thing is, I just want to say, one mentioned that the linear input process output. And I think one thing that I've never understood is, we've talked about determinants of health forever. Now, obviously, the previous determinants of health cycle ignored any underlying causes: capitalism, nationalism, post-colonialism, of the poverty, lack of education, and so on. We barely talk about health being a determinant of almost every other potentiality. People who are dead sick, caring for the sick, worried about being sick, taking food off the table to pay for healthcare, aren't going to be conscientious. Health, medical institution has become, the opposite of emancipatory, become subjugating to people. So we end up being deployed against our own will in a machine that exploits people, when our primary intention is to help them. The practical solutions elude me every day. And it's impossible to keep haggling with this when you have a patient on the table. So there is a dilemma that is, as far as my 20-something years of practice, is still unsolvable to me. Thank you.
Thank you, Tamam. Thank you. Really, really feel you a lot. Thank you for sharing that. And would any of the speakers like to respond in terms of yeah, those feelings that Tamam just shared.
Yeah, I can have a go. In terms of the indigeneity is an interesting word. I see it both as it's mainly, as far as I can see, it's a practice, right? So if I was to racialize myself, I'm Native American. I can be Native American and be practicing capitalism, but I instead choose to practice indigeneity. And you practice it to the best of the boundaries that you're given. So in the words of Martin Luther King, if you can't run, walk, if you can't walk, crawl, right? So the idea that indigeneity is completely stripped, we have to be careful with that, with those totalitarian statements. I am indigenous wherever I am. I practice that. So just because my family has been ghettoized doesn't mean that they are no longer indigenous. The second thing is indigenous people don't have to do anything. They are in practice. We have to listen to them. There are amazing movements that I am learning about all the time. Indigenous peoples in the Chad Basin, reclaiming their land, restoring it, healing the land to the point where they now have water systems in place. The Zapatistas for the last 40 years have created governance structures, from how to govern a community, to health, to education, that they are itching for people to grab those models, because that is actually the goal of the Zapatistas, is having created these models so others can adopt. Of course, we know it was close, it didn't happen, but the movement is there, of what just happened in the elections in Chile, the MAS movement in Bolivia. People are helping themselves. It is, I think, quite useless and derogatory to think that people are useless, to think that people are victims, or to think that people are just sitting there. They're not. They are helping themselves in and exploiting the resources that they have as best as possible. So for those of us that, yes, I have privilege. I am no longer in a ghettoized urban environment. My job is to listen to them, listen to my family, listen to other indigenous peoples that are in Turtle Island, and bring their knowledges forward and platform those knowledges. Okay, I will stop there.
Thank you, Araceli. We've only got 2 minutes left, and there's lots of questions on how people can contribute, what movements people can join. The second webinar is fully focused on movements and what actions we can all take collectively. So if it's okay, I'm just going to pose one last question, which is about how we can encourage people in clinical spaces, outside of clinical spaces, to move towards expansive understandings of healings. How do we get people to see their pain as part of a collective process? Thank you, Daniel, for this question. Can I give this question to Kavian, please?
Thanks, Daniel. And thanks for so many things popping off, and a reflection of the richness of the space and lots of things to pull together, I guess. It's a function of the overarching structures to drive like a neoliberal understanding or an atomized understanding of health. It's not kind of accidental that we've ended up in this place. And so the only antidote is to collectivize, right? And to understand health, and even healthcare as not unidirectional or as a service, but rather health is something that is multi-directional. Health is something that we also healthcare is something that we hold each other in, rather than something that this third party is going to be able to sweep in and do healing for. So I suppose without being too much of a cop-out, I think wanting to move away from particular conceptualizations that hold binaries, that hold people in positions of victimhood or deservingness of care, of health, of love, and rather into a kind of a position of like mutuality, reciprocity, like symbiosis, and community. Fundamentally, community doesn't have to be place-based or localized necessarily. There's expansive definitions of community, but that's really what lies at the center of this, I think, as far as I'm concerned, and with the constraints of 60 seconds to answer the question.
Thank you, Kavian. Final question for Renzo, if that's okay. How do we engage local-based scientists towards building collaborations in research and sharing experiences on addressing climate and health?
You know, I got my doctoral degree from the global north. But right after my studies, I decided to go back to Asia because I have a strong belief that, you know, it's part of my obligation to make sure I am able to apply what I learned to address problems here back at home, but also I'm able to also contribute to the creating of spaces so that more fellow young people can be equipped to become part of these global discussions in investigating some of our, you know, pressing problems and in the finding of solutions. And so I hope that, you know, that's with that example, you know, it gives us an idea of how we can use the knowledge that we gain, whether from formal studies or exciting experience, to connect with communities to our home, to help build capacity and to uplift others as well. You know, if you remember a while ago, our center here has the phrase planetary health. And I think planetary health is also an invitation for us to planetary humility. That is what we need. Humility, being humble. And the first part of the decolonization process is really to decolonize our minds. You know, we can't expect the world around us to transform and change if we inside are not decolonized and healed. I'll stop there. Thanks.
Thank you, Renzo, and thank you all three of you for such a rich and poetic 1 hour. It's so beautiful to be in this space, and I'm sure people would agree how rich it's been wherever you've joined from. I just want to say a very final thank you to our organizers at Race and Health, especially Sonora and Nita, for putting this webinar together. Thank you, thank you, thank you. The next webinar is in October 2022, so just in a month, and this is about mobilizing health professionals towards climate and health justice. So this is the solutions webinar, this is the ideas webinar, the next steps webinar. So please do join. There will be 2 more webinars after that, one which will be live at COP27, and then the final one which will be in January next year. And with that, I will close. And I'm also very sorry that we didn't get to all of the questions, but I hope that if you still have questions about next steps and what action looks like, then please do join the next webinar. Thank you again. Thank you, Kavian. Thank you, Renzo. Thank you to all the attendees.
Mm-hmm.